Over 4 episodes, we've built a single unified picture. Cognitive decline as a terrain problem, a brain starved of fuel, blocked from structure, deprived of nutrients, and poisoned by inflammation. If that's true, if these are not 4 separate diseases, but 4 faces of one underlying metabolic failure, then something remarkable should follow. One correction should help across many different diagnoses, not a different magic diet for each disease. The same upstream fix applied to different vulnerable neighborhoods of the brain. And that is exactly what the evidence shows. I'm Dr. Padda, and today we close the loop. From mechanism to medicine to the workup that could change your trajectory. Before anyone was arguing about keto on the internet, there was a hospital treatment. For over 100 years, we have known that a ketogenic diet controls seizures. Before effective anti-seizure drugs existed, this was the primary therapy for epilepsy, and it worked. It never went away. Today, in the most advanced neurology centers in the world, including Johns Hopkins, ketogenic diet therapy remains a standard of care for drug-resistant epilepsy. Randomized trials show more than 50% seizure reduction in roughly half of patients, results that rival or beat medications in patients' medications had already failed. Sit with that. A dietary metabolic intervention is first-line evidence-based neurology for one brain disease, and has been for a century. So the idea that changing the brain's fuel changes brain disease isn't speculative. It's established medicine. The only question is how far it reaches. Return to where we started. The Alzheimer's brain that can't burn glucose but can still burn ketones. The obvious experiment writes itself. Give it ketones. When researchers do exactly that, the brain responds. In a randomized controlled trial, a ketogenic drink improved cognition in people with mild cognitive impairment, the earliest, most reversible stage, over 6 months. A systematic review and meta-analysis of 10 randomized trials covering 691 patients concluded that ketogenic interventions improved cognitive function in Alzheimer's disease. And a randomized crossover trial of a modified ketogenic diet in Alzheimer's showed improvements in daily function and quality of life. And here is where you get the truth, because that's the whole reason to trust regen.md over the hype merchants. These effects are real but modest. The trials are mostly small and short. This is not a cure, and I will never tell you it is. What it is the first category of intervention in the entire Alzheimer's field to consistently move cognition in the right direction by addressing the cause, the brain's energy crisis, rather than chasing a single protein. That is genuinely, historically significant. It's a beginning worth acting on, not a finish line to oversell. Now watch the lever move across the map of neurology. Parkinson's disease. In a randomized controlled trial, a ketogenic diet improved both motor and non-motor symptoms, and improved the non-motor symptoms, mood, cognition, fatigue, more than a healthy low-fat diet did. Even cleaning up the diet generally helped. Going ketogenic helped more. And immediately, the honesty this series is built on. The broader review of ketogenic therapy in Parkinson's is genuinely mixed. A systematic synthesis of the human trials found the evidence scattered and inconsistent, unable to firmly conclude benefit for many outcomes, even while the animal studies looked promising. I'm showing you the trial that shines and the review that's cautious, because a physician who only shows you the wins is selling, not informing. The signal in Parkinson's is real and worth pursuing under supervision. It is not yet settled. Both things are true. Multiple sclerosis. This is an area of active, exciting clinical work, including case reports of patients improving symptoms, and in some instances, imaging changes. But I'll frame it precisely. Much of the most dramatic MS work, including series being prepared for publication by clinicians in this space, is not yet peer-reviewed. Promising, not proven. Treat anyone claiming otherwise with caution. Huntington's disease, a devastating genetic disorder, has a published case report of a time-restricted ketogenic diet producing striking motor and functional improvement in one patient. One patient. A signal, not a proof, but a signal in a disease with almost nothing else. Here is the pattern I need you to see. These are not different magic diets for different diseases. This is one correction of the same upstream metabolic failure applied to different vulnerable circuits. Epilepsy, Alzheimer's, Parkinson's, and beyond, developmental and degenerative, respond to the same intervention, supply the brain's true fuel and its true building blocks, and remove what starves and inflames it. That is the whole series in one sentence. I know the objection because I hear it in my office every week. Dr. Padda, this runs in my family. My mother had it. Isn't it just my genes? There is a gene variant, APOE4, that is the strongest common genetic risk factor for Alzheimer's disease. If you carry it, your risk is elevated. That's real, but watch what happens when you change the terrain around those genes. In a 2026 population study, APOE4 carriers who ate the most meat, the highest quintile, over 800 grams a week, did not show the increased dementia risk their genes would predict. The expected genetic disadvantage at high meat intake essentially disappeared in that analysis. And once more, the honesty, this is a single observational study. The strongest statistical signal was in the cognitive decline measure. The dementia risk number itself was borderline. It does not prove that meat overrides APOE4, but it fits everything else in this series like a key in a lock, and it points at the most important idea I can give you. Your genes may load the gun. Your diet, your terrain is the safety catch or the finger on the trigger. If dementia runs in your family, that is not a sentence. It is the strongest possible reason to fix your terrain now, while you have the reserve to regenerate. So what does correcting the terrain actually look like, done properly by a physician and not off a screen? At regen.md, a brain terrain evaluation is built on the 4 pillars of this series. Fuel. We measure your metabolic and fuel status, glucose, insulin resistance, ketone capacity, to see whether your brain is in the energy crisis we described, and how to move it toward ketone-based fuel safely, accounting for every medication you take. Structure. We review your lipids through the correct lens, not fear of cholesterol, but sufficiency of the materials your brain is built from. And we conduct a careful physician-to-physician review of any medications, including fat-soluble statins that may be crossing into the brain. Never a unilateral change, always informed. Nutrients. We test the canary and the flock, B12 and its functional markers, homocysteine, vitamin D, and the full brain nutrient panel against optimal, not merely normal. Inflammation. We assess the fire, metabolic inflammation, glycation, fatty acid balance, and we treat the mouth as part of the brain's terrain. Then we build one personalized correction across all 4 because they are one problem. This is regenerative medicine applied to the brain, not a symptom chased, but a terrain repaired so the organ can recover as far as its reserve allows. And the single most important thing I can tell you, this works best early. The more brain reserve you still have, the more there is to protect and regenerate. Waiting for a diagnosis is waiting too long. The time to fix the terrain is before the scan has a name on it. We started this series with a story you'd been told, that the aging brain is a genetic verdict, a timer counting down. I hope 5 episodes have replaced it with a better one and a truer one. The brain is a terrain organ. Feed it, build it, defend it, and much of what we've called inevitable decline simply isn't. Dementia and neurodegeneration are, for most people, the predictable result of starving and poisoning the brain over decades. And predictable is another word for preventable. If anything in this series described you, a sharp edge going dull, a parent slipping, a family history that scares you, don't wait for it to have a name. Come find out what your terrain is actually doing. If you want the full version of what I just covered, the actual studies, the mechanisms, and where the evidence is genuinely strong versus where it's still preliminary, I wrote it all down. It's a book called The Starved Brain, and the link is below. Every claim in it is referenced, so you don't have to take my word for anything.